All right. Welcome, Matt, to the Revital Health Podcast. And today we are talking about one of, and I say this a lot, I should stop saying it, one of my most favorite topics is red light or photobiomodulation. So now you are a physio, and I love that you have brought this angle and are looking at the red light from your perspective. And I'm so looking forward to hearing all about that. And so my first question to you, as I always ask people, is the story behind why you landed here. Like, why the physio drawn to red light?
Thanks so much for having me, Jody. I appreciate being on the podcast and hello to all your audience. Look, it's a great question, a question I pondered for a little while, but I guess we'll start from the start. I have been a physio for about 10 years. I started out in private practice, doing mainly the sports and musculoskeletal injuries. And then I moved into that disability and aged care sector, which is really big in Australia. And this gave me a bit of a wide variety or wide view of people across the whole lifespan. And not long after the pandemic, I started to notice the same question coming up in my clinic. And it was patients wanted something that was a bit more natural for pain relief, natural for recovery, and natural for inflammation. They were trying to move away from the medication that they solely relied on, and then move to something that didn't take that big toll on their body. So looking at a little bit of the research, I found that in 2020, we had 3.37 million people in Australia that were diagnosed with chronic pain. The chronic pain cost in Australia is around that $73 billion mark when we talk about lost productivity and the quality of life. So as a clinician, my bar was pretty high in recommending something that was going to be worthwhile for people to purchase. So it had to be safe, something that worked, something that we actually needed and be able to use themselves.
Yeah.
So that's where I entered into the fringe and red light therapy space. I found that the evidence was really, really positive. I found the uses overseas were really beneficial. And I knew that it was something that I'd be able to use with my clients, and that clients would be able to use at home and in their own setting very safely.
Yeah, no. And yeah, I think that a lot of great things are born out of need from when you actually see that with your clients or your patients. It's just, there's got to be something better here, or they're actually asking for it. And therefore, us clinicians dive into whatever we can find to try and come up with the solution. So, yeah, and as you say, it's just such a brilliant option. It's more of the natural option, but the more the research comes out, which we'll dive into, the more I'm convinced. And there's not many things that are like that I find. So I guess was there a particular turning point for you? Was there like a specific client that you can think of that really you always think made you get into this? And also the name Fringe, is that having a take on Australia's far behind nature of anything alternative?
Pretty much. Some might call it novel technology. It may be on the edge, but actually we evolved around light. Our bodies don't just tolerate it; we actually benefit from it. So that's where kind of Fringe came from. It is on the edge of something that is going to be so big and something that we can use naturally in our body. But
For sure.
there is a couple of examples that pushed me into that existing treatments weren't fulfilling. And it was a pain cycle. It was watching patients, and particularly chronic pain patients, stuck in this cycle of pain, of inflammation, and treatments, unfortunately, revolving around symptom management as opposed to an actual cause or investigating the root cause and helping them to heal. I also found that people were struggling to stick to their exercises at home, which is probably 70% of the client base I see.
Yeah. My clients be like, "Oh, the physio told me to do this,"
Yeah.
and they're not.
We've all been there.
Yeah.
All been there.
Yeah.
I wasn't great with my exercise when I was young as well. I'll admit that one. But yeah, so what people were looking for is they were looking for a bit of an adjunct to your normal therapies and something that could be used for a variety of conditions. So what was missing really, I found, with my clients was something that was passive, but that they could use in front of the TV, on the couch, at their desk, but it was actually grounded by evidence. It wasn't just, oh, it makes me feel better for the next 20 minutes to half an hour, but it actually helps me to heal long term. And therefore we evolved into this concept of red light and basically effortless healing.
Yeah. So good. All right. Well, let's dive into what it is, because it really helps people. Like, we have a red light room here that I put people in, and I just kind of like throw them in there when they're waiting for their medicines to get made up. And I'm like, go and have a red light. But sometimes they're like, well, what's it do? Like, what am I going to do in there? Like, how is it going to help me? So I think it's really nice to have this information for people as well, to then come back to and go like, yeah, what is it actually doing in my body, and why does it help so much?
It is a great concept, because some people think, well, how can like basic light actually form healing in the body? So we go to this concept of photobiomodulation and what it actually does at a cellular level. And this is where the roots of red light therapy were born. So light actually interacts with living cells. It's not a thermal thing. There's no heat involved, but it's kind of like a nutrient. Just like plants require light to grow, our bodies actually can really use light effectively. So if you think about the spectrum of wavelengths we have on a spectrum of light, or on our spectrum of light from the sun, red light uses two main wavelengths. So it uses the 660 nanometers, which is your red light, and then the stuff that we can't see, that near infrared light, which is really important because that actually penetrates deeper into your cells, and that's at that 850 nanometers of light. And those two wavelengths combined can get deep enough to target your muscles, your joints, your nerves, and even your brain now, with actually even a higher wavelength. And they produce a biological response inside the cell, which we'll talk about when we talk about mitochondria.
Yeah, sounds good. So I know there is obviously the 660, and then you got the 850, and then when you sort of like look at the spectrum, as you said, there's just so many, like from start to the rainbow, and then you've got the invisible, as you said. So that infrared component is as important. And there's obviously, different treatment regimes, like you say, or protocols for, different disease states. And I know there's so much more around dementia and Alzheimer's now. I was looking at a study that's just come out of NIM, which is, and you're part of Australia on the other side over there, and they were running with the red light helmets, and they were looking at obviously the structure of even the pulsation of the lights, and they were looking at sort of like the 12 minutes and then the 12 minutes of the infrared, and they're diving in at sort of slightly different ranges. So they're even doing that like 660, I think they were doing 680 or 670, and they're sort of having to play around with those as well, and getting some really incredible results from the research just local in Australia. So I love that they're doing this. But yes, let's dive into the mitochondria, because I love talking about that. Slight mitochondriac myself.
Mitochondria, it's what everyone remembers from like year 7 biology class,
Right? Yeah.
And people say the same line, it's the powerhouse of the cell. So essentially, like, red light is just targeting that powerhouse. So we know the mitochondria is your ATP driver, ATP production. It's the basic like cellular fuel. So when red light hits the mitochondria, it gets absorbed by this thing called chromophores. It's kind of like a chlorophyll from a plant, but in our bodies. And again, something that we would have remembered from year 7 biology class.
Yeah, we hope.
We hope anyway. But essentially what happens is the absorption of this light kicks the mitochondria into gear, and it helps produce a little bit more ATP. And the more ATP we can produce, it means better repair, a faster recovery, less inflammation, and more collagen, even more circulation. And then one of the big ones is that free radical damage that can do to the cells. So essentially, by providing light to a cell, we're actually giving it the recharge it needs. So that's its core mechanisms of cellular energy, but it also helps with a little bit of cellular defense. So it does the attack and defense, and probably the third use of the production of ATP is that circadian regulation. So that's the stuff where it helps you to support sleep when you're lying down, and that melatonin production. So we know that red light also helps those things too.
Yeah, no, absolutely. Now, one thing we look at obviously is, the pain, as you mentioned, with clients, and that was like the big predominator of like pushing that. And I've also seen some really incredible results from red light and pain for various reasons, from various types of pain. But we know that blood flow is important, obviously, and all these other components that helps to reduce pain. So let's talk about, I guess, the nitric oxide component, the blood flow, and the pain, and what you've seen in your research as well as a physio, and looking at the red light and the pain mechanisms.
Yeah, absolutely. So there's when we talk about red light and like biological components, we probably talk about two main things. So cytochrome C oxidase, or we'll just say CoOx for today's purpose, which is that engine room in the mitochondria, and then nitric oxide, which is again found in mitochondria, but it builds up around that CoOx. So what really happens is we need that CoOx to be functioning at its highest potential, to be producing, burning fuel, and really, if you think about a car analogy, lifting the handbrake off. So when we actually infiltrate a cell with light, not only do we get that CoOx firing, but we actually spread the nitric oxide that sits around that CoOx into the blood vessels. Now, that's really important for the body. So when you get nitric oxide entering into the bloodstream, it dilates the local blood vessels, or what we would call vasodilation. By producing increased blood flow around, this brings more oxygen and nutrients while clearing out that waste substance, those waste inflammatory byproducts, like your lactic acids and inflammatory chemicals. So this is really important when we talk about, say, clients I treat. So chronic pain clients, they often have an oxygen deprivation in that area of pain. We think lower back. So by actually increasing your blood flow to that area, we're helping actually produce healing. We're bringing more oxygen, more blood to an area that's been deprived. And we know that the blood is so important. It's probably a major natural healing component. So if we can increase function and energy and blood to those areas, we know that that's going to produce better healing long term.
Yeah, that's really important. Yeah, and I love to talk about nitric oxide from the point of view of how we produce more. And that's, again, it's down to obviously our circadian rhythm and our sleep. We're breathing through our nose at nighttime, hopefully. If we're breathing through our mouth, then it's not great for our nitric oxide. Even little things like not brushing your teeth or washing your mouth first thing in the morning, because the bacteria in our mouth actually produce nitric oxide for us. It's absolutely incredible. And then, so that's where I also love that you can stack with some of these treatments with the red light. That's why I normally do red light first and get my clients into a hyperbaric after, which we have here. And then you get that oxygen saturation with the, drive up of the powerhouses of the cell. It's quite some incredible things. But let's just talk, I guess, a little bit more about where clients can use this. So I know you've obviously seen quite a few different things. So obviously you've got a lot of sports people who are getting injuries. How might they actually use this therapy? And I know you'll probably get asked, is it safe? Do you have to be cautious with anyone? What sort of frequency does it look like? All these sorts of things. How contextually, what does that look like on a day-to-day basis?
Yeah, sure. So it's really interesting because the broad spectrum that red light can be used it really benefits lots of different people. We're talking about people in the spectrum of with knee pain, neck, lower back pain, with arthritis, other inflammatory conditions. And then we really start to look into the space of neurological disease, post-concussive syndromes. So it's a broad spectrum of where we can and how we can practically use red light in our body. And having spoke about the mechanisms a little bit before around inflammation, lowering oxidative stress, and helping with pain, we can really put this type of therapy or adjunct into people's lives without too much trouble. So if we talk about like, patients or clients that can use it, well, we talk about really a really, really safe and effective type of therapy. Really, the only contraindications or people that we probably would maybe push away from red light is very, very small. So pregnancy is probably one of them. And although there's no evidence to show that it's bad, but we just don't have enough evidence to really put our finger on the fact that it's safe. And any active cancer sites. If you're a little bit photosensitive to light, I guess that might be a barrier for entry. But really, for most people, red light is completely safe. We often get that question asked, can it cause sunburn, or can it cause moles or melanoma? And the answer is no, because it doesn't actually contain any UVA or UVB rays. So it's completely safe in terms of the skin, for skin health. In fact, we actually know the benefits for the skin as opposed to the bad sides of it.
Yeah.
But the one thing we probably should know is that red light can be overused as well. Just like having too much coffee in the morning or having a big night out and having too much alcohol, we can feel the effects of having too much. So it's probably important when you're going out to buy a red light product or device that you are comparing apples with apples. So looking at just the raw wattage or the intensity doesn't really mean a higher intensity doesn't mean better results. Actually, the science doesn't really support that. But what it does support is a happy medium, much like a bell curve, where something right in the middle, which what we know is about 20 minutes at a intensity of about 30 milliwatts, and that's basically the sun's intensity. So that's what we generally, that's what all the Fringe devices contain at that intensity, but also what we recommend for people that are looking at different products. Try and find something that is sun-like or sun intensity-like, and use that range of between 10 to 20 minutes as a guide for when you're using it at home per day.
Okay. And from your opinion, I know that opinions will vary considerably, but time of day, and therefore what happens, what do you feel if you overdo red light? Like what might be the bad, symptoms that people might be receiving or, feel?
Yeah, so time of day is an interesting one. So we often get asked that, when should we use red light? We generally say there's no good or bad time that you need to use it or shouldn't use it. So I always find that morning evenings is probably the best time of the day to use it, mainly because it's when there's usually no sunlight outside. So you may have been exposed to some sunlight through your occupation or exercise. So the morning evening is easiest. We also find that people that use red light like to put it on as they go to sleep. So I know personally I have a red light panel in my bedroom. So I'll pop it on and jump into bed, and that will help calm, reduce some cortisol, help that sleep cycle melatonin production. And not only do I feel better, I'm getting the effects of the red light for that. If it's more for a regional part of the body, like the lower back or knee, then obviously you need to wear a device and have that put on. So there's no particular time of day, but I often recommend morning and evening.
Yeah, I do too. I think I think it's good for people to also just see how you're feeling on both ends of the day. Like life is really an experiment at the end of the day, and it's having that curiosity, isn't it? So I always say to clients who are asking me as well, is like, well, do you feel better if you do it at night, or do you sleep better if you do it at night, or like, do you need it in the morning? Do you feel like it actually energizes you in the morning? So sometimes we are all so different, as you say, and so I think trialing it, if it's within the scope of what you should be doing, then why not? I think it's a great thing to do in life. Yeah, for sure. Yeah, it just fascinates me because we were saying off camera that yeah, it's taken a couple of years really to sort of like grab and take off. Specifically in Australia, it's been in other parts of the world for a longer period of time. Well, more, you know, more in the front eye of the media, but really just such a safe therapy, and people can, as you say, be using it at home, and it can be stacked with different things, you know, meditation, and you can be utilizing it while doing other things and still get other benefits from it. So it doesn't have to be even an extra part of your day. So yeah. So now,
Absolutely.
yeah.
I
So you
like the
go.
fact that, you know, red light can be used kind of anywhere, anytime. You pop a red light on while you're cooking in the kitchen, or while you're doing a little bit of gardening. So yeah, it's really adaptable to people's lifestyle, and it's not something that you have to put everything on hold and sit down to use.
Yeah, yeah, absolutely. We still get the good old jokes of, you know, like, oh, you know, you don't knock on the door. It's like, looks like Amsterdam, you know, red light district. And, you know, like it's the, because you can use it in your
That's
house.
the
Like, yeah. Or
Well, you can
actually,
only imagine
yeah,
when you have the red light on, lighting up a whole room, so a big
yeah.
panel. You can only imagine what the outsiders think as they walk past the
Yeah.
house.
Yeah. But I'm seeing it more and more just in my local neighborhood, taking the dog for a walk, and you're just seeing like a red window. You're like, oh, good on them. They're doing their red light.
All for
Amazing.
the right
Yeah.
reasons. All for the right
Yeah,
reasons.
yeah, exactly. Yeah. Not because someone's coming and knocking. That's exactly right. So, you know, Matt, I love talking about different devices, and obviously, as humans, I just love the observation of like growth and technology, and we are just expanding as a race, just at such a rapid rate. And so you can obviously see this with the smartphones, and so it's natural that and exciting that we're, you know, pushing the technology side and health side so fast. So, you know, I guess, you know, from a point of view of Fringe, which you created, like what makes it different? Because, you know, this is something so fascinating to me, and it's hard sometimes for people to differentiate with them, with the saturation of the social media and TikToks, and it's like even just the internet and repurposing ads and all that sort of stuff, or, you know, yeah, that loop technology that we've got going on. Who knows what we're meant to be having and what's good? So what are people looking for, and why is Fringe different?
Yeah, it's a great question, Jodie. And the one thing that when we came to Australia, we said we don't want to make a red light product that just went through a fad. We wanted to create a product that people could use effectively for a long, long time. So upon designing the product in the US, we made sure that the research was done so that the parameters and the specifications were accurate, they were evidence-based, and then that's how we produced all our devices. And then that led to a TGA approval in Australia, which most red light therapy brands don't have. And so we had to really dig into the evidence and the time and make sure our devices were compliant and consistent. So that's a big differentiating factor when you talk about Fringe. I guess the other things that people like to know is convenience. I know I'm a very convenience type of person. If the gym's too far away, I won't go. If the shops are too far away, I won't grab that extra carton of milk. So in terms of convenience with some of the devices at Fringe, they're cordless, so you're not having a wire coming off your face and your mask or your back. They're wireless, they're USB-C charging, so super easy to use. In terms of how they actually operate, it takes training for two simple buttons, the on and off button and the intensity button. So it's a little bit different to what we find in the market where red light can become a little bit complicated in terms of having a dial to work out how much you need. And then all devices at Fringe just have an automatic 20-minute shut off. And we do that because that's how much we know you need. A little bit less is also fine, but a little bit more can cause damage and reverse some of the effects. So so we built that into our systems and our products so that, to make sure that people were using it effectively. And probably last of all, the devices were built to last. They're not supposed to last 6 months to a year. They're supposed to last many, many years. In fact, 50,000 hours of LED across its whole lifespan. So it's really important that people feel like they're buying a product that is going to live with them and that they'll be able to use for a long, long time.
Yeah.
I guess probably the last thing with Fringe is we wanted to design products that the body could use in different ways. So there's a spectrum of 9 different devices that the Fringe offers. And they really range from your neurological with the head wrap to all the way down to the pelvic floor one, which we'll speak about, which is a bit of a new space and quite novel in Australia.
Yeah, I've noticed obviously your expanse of stockists is really quite impressive within the Australian market. Not many people reach where you have in terms of the retail spaces. And so, that, and I know that it takes a lot of effort to try and get the TGA to approve things. So well done for that. I can imagine a lot of sweat, blood and tears went into that one.
Plenty. There was plenty. That TGA approval takes years. So we put those years in to make sure we had the product that was going to be best, and particularly for I know as a fellow healthcare practitioner, I would be looking for a device that was TGA approved before I started recommending to clients. So we knew that was important to do first.
Yeah, absolutely. All right. So I know you mentioned that you've got a few different things that you're doing. So I think for it would be nice to sort of talk through all of those options and then land in, as you said, more of that pelvic area for particularly women's health, because I talk about it a lot on the show here and in clinic. As you can imagine, I have a lot of women coming in with various, sufferings, as I call it, which they shouldn't be suffering. And so it's more of this awareness now of women's health. There's more research being done now where there was never done before. There is more, we know different conditions now and we know more details around those. But now it feels like we are on this ever rising amount of women who now are aware, but then still don't know maybe where to go or how to look at treatment for themselves. So we can sort of land there, but maybe just take us through the different, why different areas and why not just one product for red light.
Sure. Yeah, absolutely. And we'll get to the women's health aspect because it is huge, but we'll probably just land with the 9 products. I'll probably talk about the 4 main ones that are different, and then the other ones do have a use for parts of the body. But we probably land on our panel, which is like our idea of ambient light. That's the one you can pop into your bedroom, turn on at night, and have that really pleasant ambience, which will help with your sleep and melatonin. And we actually have found that the effect not only on the body, so we can very easily sit in front of it, but its effect on the eyes has been quite impressive, to the point where Fringe is looking at, wow, actually, how can we target our eyes as an entity by itself? But anyway, that's for another conversation.
Yeah.
In terms of the panel, it's really good for clinicians that we've found using their treatment rooms, which they can really easily turn on. Athletes are starting to use it before and after training as a form of recovery, and people are just enjoying it as part of their routine. So it's just something that we just turn on, and then we can very effectively use for that 20 minutes, and then it turns off by itself. In the beauty space, we've got the face mask, which there is a few of them out there on the market. I guess our one is super lightweight and flexible. It really molds to the face nicely. We do have TGA approval for that, for fine lines, wrinkles, even a little bit of collagen production, which everyone talks about collagen as a big factor in beauty.
Yeah. It's the key word to everything, isn't it?
That's right. And I guess the unique part of this particular face mask is that it does also have a blue light setting as well, which is that antimicrobial, targeting acne-producing bacteria or acne-causing bacteria, and that extra oil that can sit on the face. So that's just another setting that you can use between the red and infrared. And I often find, I know personally, my wife wears the face mask each night. She really enjoys it. It really is funny walking into her wearing it because it looks strange.
Yeah.
But she has noticed some really good improvements on her skin. So that's
it's great for self-care, and I think that comes into the women's health piece. And we actually just feeling like you're doing something for yourself, and then knowing it works is an extra bonus.
That's right. And look, the benefit is you can still read your book or your Kindle at night, and you can sit back, and once it's done, you take it straight off. So super easy to use, that one.
That's it.
Probably the one that has caused a little bit of curiosity is the head wrap. And the reason being because we're starting to use it in the neurological space, kind of like what we started talking about, the Alzheimer's, dementia, the Parkinson's, concussion, and some TBI. Now, I know personally, we've worked with a couple of AFL and NRL players here in Australia who have had to retire from post-concussive symptoms, unfortunately.
Yeah.
And we've noticed there has been an increase or improvement in some of those parameters that they've been suffering from. And look, each case is unique, it's a case-by-case basis. But the red light, wearing it for that 20 minutes a day, we know that we're able to get light through or transcranially into the brain with that extra wavelength we have at the 1050 nanometers. So that's been really effective in helping some of those more chronic degenerative neurological conditions that we kind of hate to see in society, but we need to help and treat as best possible.
Yeah, I totally agree. I think concussion is definitely not talked about enough as well. Yeah.
Yeah, and we just don't know enough about it.
No.
Their research is coming, but where the research is versus what we're expected to implement in a clinical setting is just there's a huge gap in between those two things. So we're getting there because it's the topic of the last couple of years, in particular AFL. But we'll get there. But like we know is starting to help.
Yeah, absolutely. I love the hyperbaric for that. There is a lot of evidence with the hyperbaric and concussion, but that combination with the red light, because you're getting so many different sides of this. But wow, do I see later on in clinic in my work that gut disorders, immune disorders from, post-concussion years after. So we do have to take this really seriously. I try and talk about it as much as I can. Yeah.
Yeah, we do. And for some people, it's a bit of a sensitive topic. And we know that, unlike more neurological diseases that affect the older population, we're seeing these post-concussive syndromes actually affecting the younger populations because it's been misdiagnosed, it's been missed in sport, or there's not that training and expertise to accurately diagnose it on the spot, or be accountable to your own health and pull yourself away because it's just not known widely in a sporting sense. It's just more in an elite level that we're starting to notice the differences.
Yeah, absolutely. And I think it's also for people, like the purpose of doing this is actually knowing there's options and knowing what they need to go and do. Because I think it's just lack of information sometimes that they're just not knowing I have this or this has happened. What do I go and do about it? And this is where you're giving more options for people then to take charge of their own health. Yeah.
Correct.
Yeah. So good.
I think that will come with education. But as you probably would know, Jody, that when evidence comes in and we know something that works versus implementing that into practice, that can take between 10 to 15 years. So we have some catching up to do.
For sure. No, I agree. And especially when you're, under a banner like APRA, I'm not saying anything on here, but, you have to be careful how you practice. This is where naturopaths can maybe suggest something a little bit more recent in the research.
It's a scope of practice, isn't it?
It is. It is. Yeah.
Remain as tight as you can within that scope because
got to behave. Dear. All right. Well, let's move on. Let's talk about the pelvic wand then, because I'm really interested about this one.
Yeah, it is. It's fantastic. Look, where do I start? Fringe is one of the only companies that have produced a wand like this. There is semi-similar devices, but none as complex and catering as the pelvic wand. And it caters for a number of conditions. So we know it works by stimulating tissue repair in the pelvic and vaginal region, helps with that local inflammation and pain in the reproductive cavity. It helps increase blood flow to those pelvic organs. And then we've got the blue light setting as well, which is that, again, that like the face mask, that antimicrobial managing pathogens, which is a really common spot that females have issues around infection. So we've seen some really promising results in a number of conditions with the pelvic wand around like thrush, HPV, vulvovaginitis, some urinary incontinence, and even like some sexual dysfunction. And then we've started to use it with the menopause population, which is huge around that 50 to 55 age mark, which have had, have gone through a number of changes in their reproductive system. And so we've seen an uptick in pelvic wand use to help with pain and even some hormone imbalance. I guess it's worth mentioning that technically any fringe device can be used anywhere, but I guess the pelvic wand is probably the most unique. It's the only internal device that we provide, and for some very, very serious issues that women face, and we'll probably talk a little bit about endometriosis at some stage as well.
Well, yeah, that's what I was going to actually say. All these things that come into mind of the treatment options for women that I see. I deal a lot with topical cannabis treatments for women with endometriosis because it is so remarkable in how it supports. But I'm really going to be interested to see where this space goes with red light and endometriosis and PMOS, or what it was called PCOS before that as well. That prostaglandin increase, and just even around those times of when you're more sore and swollen and bloated, to really help to support that area. So yeah, what have you seen? Have you had any comments back around endometriosis and the wand yet?
Yeah, well, we have. And like you mentioned before, there's this gap in this research, and we know that like with endometriosis, it affects around 1 in 10 Australian women, which is roughly about 8 to 900,000, and coming with a huge economic cost as well. And the worst part about it is that the diagnosis usually takes around that 6.5 to 7 years on average.
Yeah,
which, I find ridiculous. Astounding.
Yeah, and normally it actually takes a invasive sort of surgery situation to be actually properly diagnosing. That you can't get much before that, unfortunately.
Absolutely. We still basically, as you said, need surgery to definitively diagnose endometriosis. And treatment then after that is often trial and error. Is it hormones? Is it more surgery, or is it hormones and surgery? And kind of where do we end? Surgery is invasive, it's expensive, it's not always curative. So we found that the red light that the wand actually emits and provides inside has provided a healing effect. And we're not calling it a complete fix and cure, but a management strategy that helps with that endometriosis. So the increased blood flow and reducing inflammation in that cavity, we've had some great results from women that have come up to us and said, well, you know what? You've really reduced my symptoms during those heavy times of the month where my endometriosis flares up. So we've been really proud to promote that, and we know how big of a problem it is. So if we can provide a footprint or an avenue to help women, fantastic. We want to be there.
Yeah, absolutely. And I think, as you say, nothing is cure, because we can never claim that, being, good, behaving. But also it is something that we can't guarantee for any single person, because we're all so different. But also we know that endometriosis is a different kettle of fish. And so it is about managing symptoms and, keeping it as manageable as possible, and supporting women so they can have a full, healthy, amazing life without the symptoms. But we don't know as yet if we're ever going to be able to reverse the condition. Advances keep on coming, so we never know. But at the moment, it is still a very unknown disease state.
Correct. Yeah. We know that. I think we've seen an increase, an uptick in funding. We had a women's health inquiry here in Victoria a couple of years ago, where women across the state were able to lodge submissions into their women's health pain, which is fantastic. So the more we talk about these things, the more recognition it gets as a serious problem. And hopefully one day we're not just managing the condition, but we're actually finding a long-term fix for it.
Yeah.
Until then, we look at all the options, and the pelvic wand is a great one for women out there.
Yeah, absolutely. I'm really fascinated by this. I'm going to have to get one into the clinic and start clients and get them onto it or buying their own. It would be, well, obviously we can't share, but it's something that we could be able to get clients onto.
Just to clarify, he's a private home based.
Yeah. Yeah, exactly.
Really, interchangeable. As the other devices might be, but not the pelvic one.
No, we want to keep that. So we'll stock a couple, and then everyone can grab their own. All right.
Correct. Yeah. But, it is nice to see it like in real life.
Yes.
If I know a couple of pelvic health physios have brought one into their clinic, and say they just show their clients how it works, what it looks like, and you can touch and feel it, and those things actually really help give confidence to what you're going to use in your body.
For sure. Yeah. Because it is, it's for most women, which I find, of any age. And actually, it surprises me how many 60 and 70-year-olds are still very much unaware of their own bodies because they were never taught to be. And so it can be a scary thing, not knowing what the machine's going to do or how it's going to feel, or is it going to give me pain, or, so yes, you're right. It just really helps that barrier to treatment and for them to be confident with the usage of it. Yeah, for sure. Yeah. Amazing. So, Matt, let's talk about future. Yeah, I know you've got probably more plans for things, as we all do as business owners and creators, non-stop thinking forward. But, where do you think this is heading in terms of the red light industry? And then also, tell everyone where they can find more about Fringe and, all the good news and fun things that you're doing.
Yeah, fantastic. Look, we know that red light is huge, particularly in the US and even in Canada. So we see red light entering the Australian market across a number of domains. So primarily into people's homes that after being recommended by a healthcare professional. So we're seeing it being recommended in the medicine, sport, particularly the sports medicine space. Where we're starting to use it a little bit in the neurology, ophthalmology, certainly dermatology space. We haven't touched on that much today, but the mental health space around depression and anxiety, and now, as we spoke about, in the women's health space. So we see it as an option for clinicians to prescribe or recommend for the management of pain and inflammation, amongst a couple of other things.
Mm-hmm.
And we see it as emerging over the next 5 to 10 years as a standardized clinical protocol for a number of conditions, with even government bodies publishing formal dosing through the public hospital system.
Yep.
We also probably would love to see photobiomodulation become a first line adjunct to standard physio and GP in allied health clinics. And what we are also seeing from overseas, and we'd love to see emerging here, is actually the substitution of heat packs and ice packs for red light, which is, again, people are like, well, I don't feel anything, but it's actually more than just what you feel. When we talk about red light, it's actually what happens inside at a biological level. So those are the kind of the things that we're aiming for. Where one of the biggest things is education. Red light has been around for hundreds of years. We talk about going back into where our ancestors millions of years used to use light from the sun as their healing, as their
sunrise, sunset. Yeah.
Right, the sunset. I mean, the old, have you had your 20 minutes of sun today, or 10 minutes of sun today? That was their healing. So
exactly.
So we know that we've used it, and the presence has been around for a long time. But it's finding a way to actually use it effectively, finding a way to use it practically at home, and providing that education to clinicians all around Australia and healthcare practitioners is really important, so they can then go ahead and educate their client base for practical ways to form part of their entire treatment plan.
Yeah. Yeah, for sure. And I think hit the nail on the head there. It's also about sharing that quality information and just having people being aware of it. And it takes a lot to be able to share it to a population that may not be ready for it yet. And that's what I've noticed over the years. You could get some populations, like you said, it's more popular in the US and Canada and even UK, and then but you get into Australia and it's like you can be talking, and no one is listening.
Yeah, we're a country of influence by our neighbours, so we almost like to see it 5 to 10 times before we're willing to try it ourselves. Whereas you look at the US, for example, and they want to try everything they can to almost be ahead of the curve, not behind.
Yeah.
So our mission is to be able to make this technology accessible to every Australian.
Yeah.
But the step before that is you need to understand what it does and understand its benefits and be educated by it about it before you're going to go and buy one. So that's probably where red light is at, and then where we want to aim for in the future.
Yeah, really good answers. I love that. All right. So where can people find Fringe? Especially, you're also in US or mainly marketed for Australia?
Yeah, so we're in the US.
Yeah.
We're in Canada as well.
Okay.
But so in terms of Australia, we distribute all over Australia, and we're primarily online. So we haven't got necessarily a retail shop where you can go in and buy one, but you can certainly chat to us online at our website, fringeheals.com.au. And go ahead and you can like our Instagram page, Fringe Heals AU, and our Facebook. We're all over socials. We've just entered the TikTok space, which is kind of new
good on you.
Well,
I haven't breached that yet. I'm like, there's one more thing to do.
Look, it wasn't actually my idea, but it is a space where lots of young and older Australians are using for their information.
Yeah.
Right or wrong, but that's
we got to get on there and correct the information then.
Yeah, well, we're always alert for misinformation, aren't we, out there?
Yeah, absolutely. Oh, that's beautiful. Well,
and look, other people are purchasing through a couple of our partner retail stores. The best way to check us out and get any information that you need is probably at our website.
Yeah, amazing. It's been an absolute pleasure, Matt. It's so easy to talk to, and also you have such a wide range of information, and you just know red light so well. So I really appreciate your time today.
It's been an absolute pleasure, Jody, and thank you for your time. And again, all the best to your audience. And bring on the red light.
I know, bring on the red light. We'll have to get some of the wands in. Look out for those guys. Remind me if I don't have them in here yet. All right. See you, Matt.
Thanks, Jody. See ya.